So in 2019, we were approached at Bonheur Community Outreach by Urban Child Institute to begin a pilot project with Memphis-Shelby County schools. And in August of that year, we were able to place 5 nurses in 5 schools. We've also developed relationships with a charter school program in the city, and that is the Journey Community Schools.
I think it's very important to have a health program in schools because children who are not healthy can't learn. And having a school health program or a school nurse that is able to treat minor illnesses and injuries or assist children who have chronic diseases keeps them at their most optimal state health-wise so that they are able to learn and be educated and receive the education that's so important for them.
Well, in Memphis-Shelby County Schools, their health services program puts nurses in the schools, but they are very spread out in the county. And so there's not a nurse in every building. What we wanted to prove with the pilot project is that a nurse in every building really makes a difference.
The most common medical issues that I address are students with asthma, type 1 and 2 diabetes, students who may have vision impairments or hearing impairments, students with special needs such as autism, any type of disability. By having a Bonheur nurse on site each day, it makes a difference.
Bonheur has a great reputation in the community, and so that kind of starts us off at an advantage. School personnel and parents trust the Bonheur name, and a lot of times even before they know their school nurse, they know that it's a Bonheur nurse, and that's important to them. Another really important aspect to that is all of the resources that are available through Bonheur for our nurses and for the administration of the school health team.
So we did collect great data and really proved what we set out to prove. The return to class rate, when there is a nurse there to assess the student, it's about 85% that the student's seen and sent back to class. So 15% of those kids are sick enough that they do need to go home. When there's not a nurse in the building, that percentage is about 43%.
That's the biggest outcome I think that we look at when we're looking at school nursing and the impact that our program is having is how much are we keeping kids at school rather than sending them home. And so 80 to 90% return to class rate is where we're at right now.
I feel like we've also strengthened relationships with those schools. We had great success from the teacher standpoint. So we did an evaluation through the University of Memphis, and the teachers said, the comments were made, this allows me to teach. I don't have to stop what I'm doing to take care of a medical need that I am unqualified to handle.
My hopes are for this program is that it continues. My hopes are that there's a Bonheur nurse in every school for every child.
My hopes and dreams for the future of this program would be those people who work with schools or those people who make decisions for schools recognize how important having a school nurse is. Not just sometimes, not just one day a week, not just a few hours a day, but if there are children present, it's important to have a nurse here, keeping that child healthy and ready to learn.